Hey everyone, happy 328 Day. Welcome to our Pan Ohio Hope Ride 328 special edition of our Enrichment series. For those of you that are not yet familiar with the Pan Ohio Hope Ride, 328 miles is the approximate distance from Cleveland to Cincinnati on some of our traditional routes. So 328, or March 28th, has become our little unofficial holiday for Pan Ohio, and we're super excited to be together with everyone tonight celebrating. For those of you that don't know me, my name is Stacy McGrath, and I'm the volunteer event chair. And I just want to take a quick sec and introduce our awesome staff team. So I want to just introduce all of our staff. Up in the Cleveland area, we have Alyssa Hancock. You want to say hi really quick, Alyssa?
Hi, guys. Thank you so much for coming tonight. Happy 328 Day.
Coming to us from Columbus, Ohio, the one and only Kristin Hudson.
Hi, everyone. So great to see so many friendly faces. Happy 328 Day.
And from our Dayton market, super exciting that we're going to actually get to go right to her hometown this year, Sarah Morris.
Woo! Happy 328, everyone.
Quiet cowbell, quiet cowbell. Also want to introduce our manager for our event from the Chicago Regional Office for Determination Events, Chris Bowles.
Hey, happy 328 Day.
So glad you could all join us tonight. Like I said, my name is Stacy, and I work with an incredible group of volunteer executive committee members and statewide event committee that works very close together with that awesome staff team that you just met to put on the Pan Ohio Hope Ride. We're going to talk all about the event a little bit later tonight. So for those of you that are new tonight, we can get all your questions answered. Do you want to talk about a couple housekeeping issues before we jump in? We're going to have some raffles at the end of the evening. So we're going to be giving away some Pan Ohio swag, some determination swag, and one lucky first-time rider is going to win a free registration. So Kristin is going to be taking attendance for us and putting together those raffle tickets while we're on this call. So if you are new, want to make sure that if your name on your screen is not your full name, if you could shoot a private message to Kristin in the chat. If you go into the chat window, you can kind of change it from to everyone to just send to Kristin and let her know what your full name is, and let her know if you're a new guest with us tonight. We have some swag raffle, especially for new guests, and also that registration for a first-time rider. So if you're new, please shoot Kristin a quick message. The person that invited you here tonight also gets an extra entry in that swag raffle, so just let her know who invited you here tonight. Also have some other drawings at the end of the night. We've had our great month-long 328 campaign, so we're going to do the big drawing at the end of the night to see who gets that $328 in their fundraising tonight. So lots to come, awesome panel discussion, some event announcements, and then we're going to have some great fun and games. Sean McLean has also put together some awesome trivia for us to wrap up tonight. And you can play that one of two ways. If you have the Kahoot app, you can download that, or you can also play in the browser on your phone, and we'll get you all that information later when we're ready to start. So glad you're all here tonight. With that, I just want to introduce someone special. We like to kick off all of our events with a focus on our mission. And obviously tonight is all very much about the mission of ACS, but I want to introduce a special guest tonight. We like to share, I guess I could share my slide over here. Let me share my screen here for a second. So again, really excited tonight about our presentation, our March Enrichment series. Our panelists are going to be talking about health equity tonight, which is such a timely topic and such a critical thing for us to make sure that everyone, regardless of their background, race, ethnic origin, socioeconomic status, gender, sexual identity, anything, everyone deserves access to healthcare and the best health outcomes. And I'm really excited to hear about what ACS is doing in that space. But before that, I want to introduce one of our riders. We like to have someone share their message each time we do a meeting of why they ride or why they volunteer. And over the past several months, we have heard from some longtime riders and volunteers, and I'm really excited tonight to hear from a newer rider. So I want to introduce our featured rider of this month that's going to share a little bit with us why he rides. And I'll let him introduce himself and tell his story, but from Team Vaco T. Cetera, excited to introduce Dwayne Rocha. Take it away, Dwayne.
You never told me that I was going to be the first one, but wow, no pressure. Thank you very much, everyone. Can you hear me? Can you guys hear me?
We can hear you. Yep.
Okay, perfect. Also, don't adjust your TV. I'm on the basement today, so yeah, this is the poor illumination I get. Once again, my name is Dwayne Rocha. I'm from Cincinnati, Ohio. I represent the the Hispanic community in the Penn, Ohio, if you want to call it like that. When I was asked to come here today to share my story, I was wondering like what could I bring to the table? This is just my second year. I was a new writer last year. But I tell you this though, about 10 years ago or so, I was in a UDF, and I remember seeing this peloton of writers, all of them wearing the same swag, and they were coming in waves. I'm like, what's going on? I want to be part of something like this. What's going on? And someone told me about the Penn, Ohio. And in the very beginning, I was, something, I kind of want to do that, that sounds like a good challenge. I was not really familiar with the mission or anything like that, to be honest with you. I just wanted to be part of the challenge. For me, it was an important thing to do. Things happen throughout this time. And then it was just up until last year, or the year before, after COVID, or kind of wave going down, I was able to sign in, and still not knowing what to expect. I'm the kind of person that I normally don't like to ask people for favors. I don't like to ask people, especially for money. And whenever there's a sign up for a raise or for a century ride or whatever, I just paid out of pocket. But I wanted someone actually told me to please just humble down, and just enjoy the experience. And with that experience, it was me directly asking people to please donate to this cause. And I learned actually shortly after, then with each donation, there was a story. I'm not a survivor, but like many other people out there, I have lost family and close ones due to cancer. Both of my grandfathers, they died from a cancer. Some cousins in the past year or so, they also died from a former cancer. And I always say like that, there's three powerful words out there that can even sometimes bring you up or sometimes bring you down. Those are, I love you. Will you marry me? Actually, no, those in Spanish is 3 words. In English is 4. And then or something like you have a disease or you have cancer. That would bring you down to your core. And to carry that weight with your family and your loved ones, I see it from firsthand. But it's always amazing, and it's always good to know that actually there's people out there, volunteers, and people that actually there are willing to bring a ray of light and hope to these people and these families. And a good thing that I will tell the new writers this year is that you have a great team supporting you. You have they're going to be always resources. I joined the Penn, Ohio, and I drove to Columbus last year, not knowing anyone, not knowing what to expect. I shortly learned that it was not about the best, completing the best segment of Strava or see who has the best KOM. It was more about spreading hope through our ride. And I came to Penn, Ohio not knowing anyone, and I just left on my 5th day, knowing that now I have a family. I'm like on the first day, actually, I was invited to be part of a team. I was like, wow, a team now? Like I don't know any of these people, and I don't know if anyone from Team Baco is here tonight, but like those, I'm glad to be a part of a great team. And actually, I'm looking forward to many more years with the Penn, Ohio. The sky's the limit. We started without one volunteer in my family, being me. And now last week, I don't know what Sarah Morris told to my wife, but now my wife is going to volunteer this year I guess in Dayton, I guess at some point. So now we have 2 in my family. It's like I said, like again, to the new writers, like this is a big family. Again, there's a lot of resources. There is hope, you know, there's hope. And that's pretty much all I have to say. It's I'm very happy. I'm very grateful for the opportunity given to get to know every single one of you guys. Sarah and Stacy, both of you, you guys are. I feel like you are the first people I actually talked to when I got to Westerville last year, and and seeing your faces every day was look at these people here every single day, and gosh, you know something, next year I want to be a dynamo, you know, or the years to come. I want to be a part of something greater too with you guys. So looking forward to the road to come.
That's awesome. Let's give a big round of applause and some cowbell for Dwayne. Thank you so much for sharing tonight. I love it. I feel like sometimes we really do hear from people who have been with us for years over and over again. And I love hearing enthusiasm from new writers like that. And I'm so delighted that, you know, I think I relate to that. I showed up to my first Pan Ohio. I signed up, I didn't know anyone. I thought it was going to be this crazy challenge I did once. And by the end of this weekend, I had this family, and now we come back year after year because it's really about something that's bigger than ourselves. And
absolutely, it is. And by the way, thank you for pronouncing my last name correct. Is Rocha, not Roca. People will think that I'm Italian, but I'm not.
Well, thank you. Thank you again so much for sharing. Looking forward to seeing you up there with the Dynamos this year and getting to ride across the state for the first time since you joined us in a
true, yes, year. Very true.
So, love Pan Ohio family. It's one of those things that sounds weird when you hear it, but once you experience it, you get it. So looking forward to seeing you in July, Dwayne, if not sooner on some training rides. So thank you. With that, I'm going to share my screen again here for a moment and introduce our panelists, and then I will turn it back off so you can see their faces. And if you're not used to Zoom, you can change your view. You can either see the whole gallery of people, or if you switch it to speaker view, it will go back and forth and show you in large screen the current speaker too. So with that, with no further ado, I'm going to turn it over to our awesome hosts that have been hosting these enrichment series for us this year. I'll let them tell a little bit of their own introductions too, for those of you that don't know them, but 2 awesome longtime Pan Ohio writers and 2 awesome champions of hope cancer survivors, Jeff Darpel and Bill Wolohan. And then I will let them introduce our awesome panelists here. I'm just going to leave this on the screen so you can see their names. Then I'm going to turn it off so you can see all their faces as well. So with that, take it away, Jeff and Bill.
Okay, my name's first. I'll jump in there. Stacy, thank you very much. Dwayne, thanks for sharing, buddy. We appreciate it. So I'm Jeff Darpel. I've been doing the ride for, well, this is my 12th year, I think. I've lost count because I've been around for so long. Started back when my mother passed away. She lost her battle with lung cancer. I, last year, fought my own battle with lung cancer, but more recently, I actually just flew home to Cincinnati from Vegas last week because my sister-in-law lost her 3.5-year battle with brain cancer, and it was tough. So this ride, every year, you hear about new people who are fighting the battle, winning the battle, and losing the battle. And this ride is all about supporting those people who were involved. And sorry. So that's my story. Short, sweet. Bill, you're up.
Thanks, Jeff. I hope they put my name first next month. My name is Bill Wallahan. I've been riding 11 years. I met Jeff on my first ride, and we've become really good friends. That's, when they talk about it being a family, sometimes it's even more than that. Jeff and I have, we get together, a couple of times a year outside of Pan, Ohio, even though when we met, he lived in Cincinnati, I lived in Cleveland, and now he's wherever he is. He's all over the country. It's crazy. My cancer story started, 2006. I had bladder cancer. And then 3 years after that, my first wife died of cancer. So it's been, it's hit me hard a couple of times, and it's hit me, a couple other times. I actually had skin cancer back in my 20s. Yeah, so when I first heard about Pan, Ohio, I'm like, this is something I have to do, and I'm so glad I did it, because every year is just amazing. So this is this is fantastic. It's a fantastic group of people doing fantastic work. So I guess we should just jump in and start with our panelists. We have 4 panelists this evening, and I'll go through them. I guess we'll go through them one at a time. So first up, we have Hailee Dorflinger. She's the ACS Associate Director of Development, and she's going to talk to us about fundraising for health equity programs. So Hailee, go ahead and take it away.
Thanks, Bill. Appreciate it. It's nice to see you, as it is so many other familiar faces on this call. I see a couple new ones too, but I had the pleasure of supporting Pan Ohio a few years ago, and similar sentiments to what you guys shared. It becomes a family. I'm looking at Sarah and thinking about the turkey handshake and just these silly things that we, do along the ride to motivate and keep each other going. So when Alyssa asked if I could come and speak today, I was super excited because I get to come back and hang out with an awesome group of people and share a little bit about some of the important work I'm doing now with this society. So Stacy, is there any way, oh, you are magic, I could get screen sharing access, and I got it. You read my mind. All right, let's see. Bill, you're on my screen. Can I get a thumbs up that you guys can see that? Thank you. All right, awesome. So again, happy 328 day. This is a special day, so I'm like I said, a pleasure to be here tonight to be able to talk about a really important topic, and that's health equity. So we've got a great panel of speakers today who are going to talk a little bit more about our health equity work. And I thought, since I was going first, I could just share a little bit of background, provide a little bit of context about exactly what we mean when we say health equity, and then we'll share a little bit about some of our work here at ACS. So we know that cancer affects 1 in 3 Americans, but we also know cancer doesn't affect everyone equally. And the way that we at ACS define health equity is that everyone has a fair opportunity to prevent, find, treat, and survive cancer. So I've got a visual here on my next slide to kind of help demonstrate this. And this visual is from our friends over at the Robert Wood Johnson Foundation. Thought it was quite fitting for tonight, cyclists. So you can see up on the screen here, we've got 2 rows of different cyclists to really explain the difference between equality, which is on the top row, and then equity on the bottom row. So we know if everyone wants to go for a bike ride, they need a bicycle, right? But not everyone can use the same bicycle. They need one that fits their needs. So if you look up on the screen, you can see there's a child on the far right. The child needs a child-sized bike. The person in the wheelchair on the left maybe needs a bike with a little bit more balance. But then on the bottom row, when you see everyone given a bike or given what they need, which is equity, they thrive and they can be successful. So, we're kind of going to take that approach when we talk about health equity in the cancer space. So we know we have to do some work to remove obstacles to health and healthcare, poverty, discrimination, access to transportation, access to food, lodging. And here at ACS, we do that through a variety of avenues: health equity research grants, access to care programs, advocacy, patient support. You can see a few of them listed here up in the screen. We implement cancer control interventions, partner with community organizations and coalitions to reduce disparities. And you're going to learn a little bit more about that today from Angela and Amy, who will talk some more specifics. But I want to kind of share a little bit more detail about our research here. So in total across the country right now, we have 61 grants that total about $50 million, and that is in the health equity research space specifically. But what I think is really special is that here in Cleveland, Ohio, out of the Case Western Reserve University, we do have a funded researcher by an ACS funded researcher who does work specifically in the health equity space. I've had the pleasure of working with Dr. Kaloush on a couple different projects now, and she's doing some really important work evaluating Medicaid expansion and cancer outcomes. And I think, you know, I just want to say she's so intelligent, she's so passionate, and I feel just even more, I think, empowered and encouraged by the work that she's doing, knowing that when we fund health equity, we're funding minds like hers who are going to, you know, get us that research that we need to ultimately make a real impact. So you may have heard this before. Our goal here at ACS is to reduce cancer mortality by 40% by the year 2035. And so when we really look at that big picture, we know we have to also focus on communities that experience great disparities in cancer screening, diagnosis, and survival. So kind of given that background, we launched our HERO initiative, and HERO stands for Health Equity for Research and Operations. And really that was the American Cancer Society's recommitment to continue this work, because as Stacey said at the beginning, you know, we really believe no one should be disadvantaged in the fight against cancer because of how much money they make, the color of their skin, sexual orientation, gender identity, disability status, or even the community that they live in. So you can see some critical communities that we know we really need to support here up on the screen. And just a couple statistics that I'll share that I think are kind of alarming. We know only 3% of oncologists are located in rural areas. So that makes access to care a huge barrier for approximately 60 million Americans who live in rural areas. We know Black women are 40% more likely to die of breast cancer than white women. And we also know that
where are you going?
I think we've got a little bit of background noise. There we go. We also know that 1/5 of Latinos under the age of 65 that report they have no health insurance coverage. So something I think really important that about this data, not only is it alarming and are these some big numbers, but all of those numbers are people, and they're people right here in our communities. They're in Cleveland, they're in Cincinnati, they're in Dayton, they're in Columbus, and they're people, they're not just numbers. And that's really why this work resonates with me and probably resonates with all of you, because it's about, again, finding that equity for our communities. So kind of given the why, given the background of that space, we know that in order to move work forward, we need to fund it. And that's where we launched our League of Heroes campaign to help fund the work for the awareness in the battle, to fund the awareness for research and operations. So like Pan Ohio, League of Heroes is a fundraising campaign, and we restrict all the funds raised through this campaign to health equity. So those things that we just talked about, critical research, advocacy efforts, access to care, patient support services. So really grateful to be launching this first year campaign. We've got generous support from United Healthcare as our presenting sponsor. We also have a leader from United Healthcare, Dr. Marugu, as our executive chair. So a lot of support. We know this is important work to the state of Ohio and across the country, truly. So we kicked off the campaign officially in March. We hosted a really important and impactful conversation with Dr. Kaloush and the researcher I mentioned earlier, and Dr. Marugu, our executive chair. It's really, but it served as the launch of our campaign, but really was a conversation about health equity and kind of diving into what it means and how it affects people's day-to-day life. And there were just some really, I think, important things that were said during that conversation that I probably can't do justice. So I will put the link to that conversation in the chat if you're curious of learning more about some of the work happening right here in the state of Ohio. So really quickly, I'm just going to go over the nuts and bolts of this campaign as a fundraising campaign. We're recruiting local sponsors and heroes or fundraising ambassadors to help us raise funds to fuel this work with the goal of $75,000. And truly, we know, this is important work. This is work that we can't do alone. It's work that's not going to be solved this year or probably next year. It's going to take years and years of hard work and dedication, but really grateful to have the opportunity to work on this campaign with some really dedicated advocates in our community, some amazing volunteers, a great group of staff that you're going to hear from here in a moment, as ACS really has launched this HERO initiative to recommit to continuing the important work. So that is a kind of quick overview, I think, of health equity in the American Cancer Society space, the League of Heroes campaign. I'm going to hang around for Q&A and maybe a little bit of fun later because I know how fun this group is. And I think I'm tossing it over to Angela Kaloush.
Hi, everyone. I'm Angela. I just wanted to take a few minutes and share a little bit about what my department does around health equity projects. So I am the strategic partnerships manager for our cancer control team up in the Cleveland area. And I work with community health centers, hospitals, other community organizations and coalitions to collaborate on cancer screening and prevention, as well as patient programs. And I've been in this role since about 2015. It's been really rewarding working with underserved populations on improving cancer screening through quality improvement work. And a lot of this work centers around the goal of achieving health equity. So like Hailee said, that's meaning that every person has a fair opportunity to live a healthy life. And that means access to cancer screenings, being able to catch it early, and then options for treatment. And it also requires the reduction of barriers to care. So a lot of these projects that I've worked on, we're looking at different barriers that patients face in accessing their care. So these could be like transportation, language barriers, cultural differences, financial barriers, and other things like that. But specifically, Alyssa asked me to highlight one project that we are working on here with University Hospitals up in Cleveland, and this is the Hospital Systems Capacity Building Project, and I am in my second year with them. So I've been working with UH for just under 2 years, but when I started working with them, there was a new opportunity to join a nationwide cohort of the ACS Hospital Systems Capacity Building Project. So this allowed me as an ACS staff to work closely with a hospital system to focus on an area of health equity and really just addressing a need in their community to increase access to care and improve patient outcomes. So I nominated UH, they were selected for this 3-year project, and they've chosen breast health equity to focus on. And this was due to the need in the community, but also the resources that UH has available to them to address these needs. So early on, kind of like in the beginning of last year, our team designed the project by reaching out to community partners. They knew they wanted to achieve this community outreach through community health centers. So these are federally qualified health systems. We have several of them up here in Cleveland and several partners throughout the state. And they wanted to provide their mobile mammography services at the health center sites. So this meant, they have a newer, this huge van where patients can go, it's more like a trailer, but patients can go onto the trailer and receive their mammogram screening by UH staff, receive patient education. It's really just a fantastic vehicle. And this is something they wanted to bring to community health centers to address that, to overcome that barrier of transportation for these patients. So in year 1, we partnered with a community health center down the street called Centers for Families and Children. It is just down the street from the ACS office if you've been. And we have also partnered with the Breast and Cervical Cancer Project of Ohio through the Ohio Department of Health. And this group, they will provide the cost of screening for patients who are uninsured or underinsured, which is huge because a lot of the FQHC patients that we serve fall into one of these 2 categories. So by bringing this mammovan to underserved areas of Cleveland surrounding the FQHC partner, like I said, they're reducing that transportation barrier need. And that collaboration also addresses the financial barriers that patient faces. So they don't have to worry about how they're going to cover the cost of screening if they're uninsured, or if they are insured, maybe their deductible is high, maybe they have other costs involved that they can't cover. So BCCP takes care of that aspect of it. So last year, like I said, it was our first year. We provided 4 screening events at the Circle Health Services down the street, and we surpassed our goal. I want to say 95% of the patients that we served last year were women of color, which was our goal. We wanted to provide these screenings for patients who needed it. And by utilizing that mobile mammography at our partner site, we brought the screening to them. And in year 2, which, you know, we're already kind of kicking off our plans, we're expanding to another community health center, but we're also going to be serving that same health center from last year. So now we're going to be working with 2 FQHCs here in Cleveland to reach more underserved women, to expand our footprint of who we're reaching. And university hospitals at every screening is also providing that really important health education to the patients, telling them what to expect, telling them how often they should be doing this. And I should also add that a lot of the patients that we are screening through this project are women who have never had a mammogram, who are very overdue for a mammogram for whatever reason. So there's a lot of hesitancy to get screened by patients. And so just bringing that mobile mammogram unit to the health center is meeting the patient where they need to be met at. And in year 2, we've got a few other things planned. We're going to be working more closely with health center staff on provider education, letting providers know, you know, the latest and greatest about mammography, working with staff to kind of create process flows on how we can streamline our referrals from the FQHC to the hospital. And that is it for the UH project. And I also just wanted to highlight our department at ACS has also been hosting health equity virtual series conferences for the past year. So we just held one last week, which looked at colorectal cancer screening through the health equity lens. Remaining conferences we have this year, in June, it will be on HPV. In August, it will be on breast cancer. And in November, it will be on lung cancer. So we invite our health system partners to present in panels or keynote speakers at these virtual meetings. Anybody can attend. If you have an interest in any of these, please let Alyssa or Kristin or Sarah know, and they can send you my information. I'd be happy to share out the invites for the remainder of the year. And it invites our health system partners from Ohio and West Virginia to kind of share best practices on what we are doing in the cancer screening community. And that's all I have. I will stick around for questions also. I know I kind of rambled through that, but if you have any questions or want any more information, I'm happy to provide it.
Great, Angela. Thank you so much. No rambling at all. That was awesome information. We appreciate it. Our next panelist is Amy Magorian. I believe I'm saying that right. She's not able to join us live, but we do have a video recording of her. She's the ACS Cancer Control Strategic Partnerships Manager in Columbus. And will be talking to us about engaging with the LGBTQ plus community. So I'm not sure who's queuing up the video, but take it away, guys.
Sorry, one sec. I thought my audio settings would save from last time, but I gotta go share my audio here. Try this again.
Good morning. My name is Amy Magorian, and I'm the Strategic Partnership Manager in Cancer Control for the American Cancer Society, working in the North Central region. I live right outside of Columbus in Baltimore, Ohio. So I have the pleasure of talking with you today about a new program that we are implementing with the Ohio State University. So the American Cancer Society, through funding from Merck, is launching the first of its kind LGBTQ plus and Cancer Care Project Echo pilot in May of 2022. This pilot will use a state-based approach in Michigan, Ohio, Indiana, Kentucky, and Tennessee. The ECHO series will include educational and planning sessions with all 5 states participating together to enhance the collaborative learning opportunities. The goals are for participants to gain knowledge and confidence to address the overlapping and common barriers that exist in the LGBTQ populations in accessing primary care, cancer risk reduction, cancer screenings, and survivorship care. This will be reflective of their unique cultural, geographic, and payer landscape. So this slide shows more of the project details. We are in the process of phase 1, which involves recruiting the anchor institutions from the 5 states, Ohio, Kentucky, Michigan, Tennessee, and Indiana. The core faculty from those institutions and the spoke sites, which are also called primary care practices, will work with this project. In addition, the anchor institutions will each receive $10,000 to help offset their time and participation. So it's estimated that 50 clinical staff total will actively participate, including primary care physicians, nurse practitioners, nurses, medical assistants, and any other ancillary staff that can enhance the quality of care for their LGBTQ+ patients. To date, we have The Ohio State University, the University of Michigan, University of Louisville, Indiana University, and Vanderbilt all confirmed to be part of this project. So during phase 2, core faculty from the anchor institutions will develop curriculum that will be used at 2 to 3 primary care practices affiliated with the anchor institutions. Again, those are also known as spoke sites. The curriculum may include stigma and sensitivity, tobacco use and cessation, breast, colon, lung, and cervical cancer screening, including specific needs for the transgender populations. Other topics could be HIV and cancer, immunization, hormones and cancer, long-term survivorship needs, and overcoming insurance barriers. During the final phase, phase 3, the primary care practices or spoke sites will attend monthly echo sessions and present at least one case study during the series, with the final session concluding in November of 2022. And this is just a list of the value add for participating in this project. So participants are going to have access to national experts in real time, creating solutions at system, state, and at patient levels. They're going to receive the latest knowledge related to LGBTQ+ and cancer care, including the barriers and known evidence-based informed practices. The anchor institutions are going to serve as an architect to build the strategies for increasing an access to welcoming, safe, and competent care for this population, with the goal of reducing disparities and improving equity. And finally, what I think is the most important, it's going to save more lives and improve the overall quality of life for the LGBTQ+ community. Just in summary, these are the three phases and estimated time frame. So we are currently wrapping up phase 1 right now. We've recruited our anchor institutions. We're getting budgets set, faculty identified. We had our first call with all the faculty on March 18th. Phase 2 is curriculum development and orientation. That will run February through May. These will be virtual calls. And then finally in phase 3, we'll have the actual echo sessions created and ready to distribute to the primary care.
Did we lose the video?
I think we lost the video, Stacy.
Through this project
Sorry about that. I did think let me get this back to where we were and restart. Sorry, my bad. Bad at technology.
Don't tell our boss.
Distribute to the
About where we were?
Yep.
primary care sites and to their patients. These are just a list of some of the internal and external resources that are available. And we hope to see this grow through this project to increase education, programming, and services for the LGBTQ plus community. So just wrapping up, thank you so much for letting me present this project with you. Thank you for all you do, making it possible for us to have these programs and services, not only in Ohio, but in North Central region and across the United States. We couldn't do this without you. Have a blessed day, and please let me know if you have any questions or need additional information. Thank you.
Great. If someone could pass our thanks on to Kara for that, we'd appreciate it. There's good information, and always good to see, good to see that kind of stuff happening. Our last presenter is Amy Magorian, I hope. She's the, that was Amy. Our last presenter is Kara. You got me mixed up. So pass our thanks on to Amy. Kara Stock is up next. She is the ACS Hope Lodge manager, and the Hope Lodge is near and dear to all our hearts. She's going to talk about interacting with underserved community members. So take it away, Kara. Thank you.
Yeah. So hi, everyone. I'm Kara Stock. I am the senior manager of the Cleveland Hope Lodge. So I have been the senior manager for just a little under a year, but I actually joined my ACS career as the Hope Lodge volunteer coordinator back in 2014. So I know some of you are familiar to me, some of you with the open house, and maybe you also came up for one of the kickoffs. I think I started roughly right around when one of the kickoffs was here at the Hope Lodge. But a little bit about the Hope Lodge, if you're not familiar. So we are a completely free place to stay for people who are traveling to Cleveland for cancer care. We opened up in 1995. And we have now just undergone a pretty major renovation to our existing space. So I'm going to talk a little bit about what's been going on here with the renovation, and then just a little bit about since we've been able to reopen. So from a campaign standpoint, we're, I think I haven't seen all the complete numbers, but I think we're around 80% of our total capital campaign budget. So we are getting really close thanks to events like your guys's that help support our renovation. We have completed phase 1 of the renovation. It was broken up into two sections here. So we took the opportunity while we were closed to get a jump start. Since we weren't able to serve guests with everything going on with the pandemic, they decided to kind of get started on some of the renovations that would have been pretty disruptive for people while they were staying at the Hope Lodge. Sorry, my dog's busting his way into the den as we speak. So we have done a complete renovation and expansion of our dining room and kitchen. Sorry, I'm getting distracted here. My daughter's also trying to get him out of here for me. Oh, all right, come on. So we went from 5 kitchens to 8 kitchens. We expanded the dining space for them. We have done a complete renovation of our administrative spaces as well. So when guests come in, they're welcomed to a new lobby. They're able to sit down and we can go over paperwork in a private space with them. We also now have a conference room. So when we can open up to visitors and guests again, groups like yours can host smaller meetings in our conference room. Also part of phase 1 was refreshing the existing guest rooms. So we currently have 31 rooms in the lodge today. They all got a fresh coat of paint. They got a completely new bathroom and a new upgraded HVAC system. So now they have their own clean air return. So each room is getting their own clean air, which is obviously really important with everything going on for guests, so they can feel comfortable taking their masks off when they're in their own private space. So we are looking forward to wrapping up the capital campaign so we can begin phase 2, which will add an additional 12 rooms onto the Hope Lodge, as well as a meditation space for our guests and a family room. It'll also have an additional elevator and more laundry facilities. But we are looking forward to that. We will remain open for that. They will be building it kind of as a separate piece of the lodge and then breaking through the 2 hallways at the end. So we will be able to serve guests and their caregivers during most of that construction. We were able to open back up November 15th. We welcomed our first guests back to the Cleveland Hope Lodge. That was really special. It took a lot to get the lodge ready for guests. We still are putting final touches on here or there. We've had a lot of supply chain issues that I'm sure you've all have heard about over the past couple of months. So getting all the final touches done to the lodge. But we, right now, we are currently 50% occupied. So we have 15 rooms occupied, 30 guests staying with us. By the end of the week, we'll have 6 more rooms or 12 more guests with us. And then next week, we'll have an additional 8 rooms checking in and 16 guests. So we are getting up there. We have been able to serve every eligible referral that has been made to the Hope Lodge from our referring partners. So we're really happy that we've been able to serve everybody that has requested a room. We were originally restricting guests just to kind of make sure that we can safely social distance, but we've been able to manage all of that really well. And we feel like with the requirements that we have in place and the social distancing and the masking, we'll be able to, like I said, accommodate everybody up to our 31 rooms. So I will, I guess, open it up to questions.
Okay, Kara, thank you. I have a question, personal question from me. Can you talk a little bit about the qualifications for visitors and how a person can get in and get a room?
Sure, yeah. So we work with the referring partners to identify a need. So we get all of our referrals from social workers. So thanks to Angela and Tiffany, we have those relationships with like UH, Cleveland Clinic. We have social workers at Metro and the VA who are aware of what we do. So they would make the referral to the Hope Lodge. The qualifications to stay is they have to be in some sort of active cancer treatment, surgery, chemo, radiation, clinical trials. They need to have a caregiver that comes and stays with them. So, we're not a medical facility. We're truly just a lodging piece. So they would have a caregiver come stays with them, and they have to be 40 miles or 1 hour's drive outside of the city. So kind of that, barrier to treatment, if they can't make that drive back and forth outside that timeline. For our bone marrow transplant patients, they can be 30 miles or 45 minutes because that's the restriction that, their doctors put on them at all times for 30 days, 60 days, 100 days. They have to be within, 45 minutes drive time of the hospital. So we have that for them. Right now, we do have the additional requirement that everybody that enters the lodge has to be fully vaccinated. So the cancer patient themselves can have an exemption if their treating oncologist feels like it wasn't safe for them to be vaccinated because of what they were going through. But again, it has to be an exemption from their oncologist, and their caregiver does have to be vaccinated. But these are some of the things that are in place so we can, by the end of next week have 26 rooms occupied. We're just doing everything we're trying to do to keep the people in the lodge safe, and this is one of the metrics that we use to do that.
Great, thank you.
Mm-hmm.
Well, looks like there's a question in the chat.
Let's see, okay. So we don't need volunteers for transportation for the most part. We're very fortunate. We are we almost like share a parking lot with university hospitals. So they can, we're less than, we're about 500 feet from door to door from UH. And the Cleveland Clinic does run a shuttle. So that is really a majority of where all of our patients stay. We have had we've had occasional, occasional, Metro or Hillcrest patient. But Metro, I believe has their own transportation shuttle as well, but we haven't had a guest in quite a while from there.
Can I also plug something really quickly? We have a program that we're relaunching called Road to Recovery, where we have volunteer drivers who help drive patients from their home to their cancer treatment. And these are for patients, that live close by to the hospital that they're receiving treatment. And all rides, from what I understand, I think we just relaunched it today, actually. If you are interested, please get my info. I'll leave my email here in the chat. But for anybody who's interested in learning more about the program or what it takes to be a volunteer driver for this program, please reach out and I will get you the information for that as well.
That's awesome, Angela. I was curious at what was the status on that program, so thank you for sharing.
Sure.
Angela, do you know if they still have to go through the volunteer training for like the background checks? Because one thing we used to be really excited about sharing with our volunteers is that it was the same background check process for Road to Recovery as it was for like our, when we used to get our SAG and ham drivers verified. So it'd be interesting to see kind of if that's still the way that they're doing things, because it just makes it a little bit easier for people to do both options.
I don't know that answer, but I will get it from our mission team. I know that everything really has moved to an online format for training. And I think also once you provide your first ride, I think everything is virtual. So like you can review the requests for rides online and like pick up or sign up for rides, I think from your smart tablet or smartphone. But I will get more information on that. I should have been more prepared in case this came up. So I'll see how they revamped it, and I'm happy to share with anybody who's interested in more info.
Great. If anybody has questions for any of our panelists, please speak up. I'm sure, well, Amy's not around, but Kara, Angela, and Hailee are all here to answer your questions. I have, just on the volunteer thing, are there volunteer opportunities now at the Hope Lodge?
So unfortunately, there's not a lot of in-house volunteer opportunities. One thing that actually should be going live on the volunteer community is a meal delivery. So we're still not allowing people to come into the lodge, but you can drop off a meal or send gift cards, or I know there's a lot of different services where you can have it like catered and then sent to the lodge. So we are doing that, and as staff, we're setting up the meal and kind of taking pictures and sharing it, with the group for a meal. Hopefully soon. We have been given the go ahead to have volunteers in the courtyard. So when the weather is consistently nice, we're going to look to see if we have any volunteers that want to run some outside bingo, or, if you've got a musical talent and you want to come play in the courtyard, we'll take you. But we can't have anybody inside the building still, unfortunately.
Hey, Kara, years ago, my wife, when the Cincinnati Hope Lodge was still open, my wife and some teammate or workmates went to that lodge and prepared a meal and served it to the patients. Is that something do you think will come back in Cleveland, or what do you know about that?
It will eventually come back. The timing of it is what we're not sure. So we work with a team of oncologists, and some of the Hope Lodge executive leadership teams are working with the CDC and epidemiologists just to kind of find out when it's safe to bring volunteers back in-house. But I will be happy to welcome cooks back to our kitchen. It is a beautiful space. I mean, I said we can like host a cooking show. It is that gorgeous. In the lodge now, or some sort of competition, a chili cook-off. I mean, there's now 8 gorgeous little kitchens that people can come in and cook. So, I mean, I'm looking forward to the day that we can bring people back. That's actually what I started to do at the lodge. I was our volunteer group coordinator. I considered myself like the activities director of, the Hope Lodge, a cruise ship kind of type thing. Cause it's being free is a big benefit. But a bigger benefit is kind of having those activities that bring all the guests together, that get them to share their stories and support. We're seeing a little bit of it already. We had one nurse from UH would come through as a group. He said, hey, my grandma really wants to make soup for you guys. Can I just drop off a soup? And I said, great, we would love to. So I made a soup. I tapped on my mom's shoulder. I said, hey, Mom, will you make a soup? So we had 3 soups that we told the guests, and they all turned it into like this big potluck meal event. They had so much fun with it that some of our guests who are kind of I call them our long-term, our guests, they're 100 days, they're coordinating and they're doing their own potluck tomorrow night too. They said, we had so much fun last month, we're gonna do it again. So I look forward to when we can bring the groups back in and do that, because guests love it. I mean, it's, part of what makes the whole thing so special is kind of getting together with everybody. We did put TVs in our rooms. So if you were familiar with the lodge before, some people thought it was really bizarre we didn't have TVs in the rooms. There's 2 reasons. One, it was a cost savings, to be honest, but 2, it made people kind of come out of their room and meet their neighbors. Being that we're not wanting them to get together right now, we did put TVs in their room, so they have something to divert, their time. But yeah, I look forward to when we can have you guys all back in.
Kara, is the outside courtyard also getting an update, or what is changing with the campaign right now, potentially to the outside of the building?
So right now, the courtyard did get a little bit of a refresh just because we actually stole a little bit of that space for the gorgeous new expansion, but it is still a really big, gorgeous green space dedicated to the Hope Lodge, especially in that uptown area. To have something that's just for Hope Lodge guests is great. So we still have 2 grills out there. There's kind of like a new portico or overhang over some tables. So we have a lot of seating out there for the guests. We have a gazebo still some green space. And even when they do expand down the one hallway with the rooms, we'll still have a pretty good sized courtyard for them. Yeah, if they got any grill masters, you can come up and grill.
That counts me
Can
out.
I jump in for a moment, if I may?
Yes.
This is going to be a little bit of a hacky way to share, but Daryl's just been sending me some pictures. I would love to jump in and share a few photos, if I may.
Oh
yeah. Sorry, I think we should have shared some photos. We were really honored to be able to tour the Hope Lodge just before they reopened to guests. So I've just opened a bunch of photos here. I just want to show you, as Kara's talking about this beautiful kitchen space. Like she said, there are 8 of these little kitchen stations, storage for everyone to have their food in it. And Daryl just took some nice photos around. These candles represent, there's a candle in this bowl for each guest that has stayed at this Hope Lodge location. And there's over 5,000 of them. So let's see the impact that this lodge has had. Great little relaxing spaces, this little reading nook with a library. You can't read this sign from here, but the Pan Ohio Hope Ride is recognized on here as one of the supporters of the Capital Campaign. Little picture of the entryway. So just some lovely relaxing spaces, just so you can all get a sense of what a home this feels like here. I mean, there's bears there, so of course it must be a great place, because any place with bears is good, right? And again, here's just this beautiful shiny kitchen. Some of you who have been around the Pan Ohio Hope Ride for a while, when we had our kickoff dinners there, may have seen the old kitchen and dining area. And this is just so nice now, this bright, brilliant, open, spacious area. We were there in the evening, but during the day, so many windows and all that there just brings in so much wonderful natural light. And it's just such a calming, wonderful, peaceful place. So I just appreciate that we had an opportunity to tour it and see some of this. And I just wanted to share some of those photos with all of you. The other thing I wanted to share is that one of the other things we've done over the past month is collect donations for our 328 campaign, the 32ATE campaign. And we have about $500 now that we're treating the Hope Lodge guests to dinner with this week. And anything left over from a couple dinners, they'll be able to purchase some items off of their wish list for the Hope Lodge. So just wanted to share that. Thank you to everyone who donated to that campaign. We're really excited to be able to treat the Hope Lodge guests and staff this week to celebrate 328 Day.
Thank you. Thank you guys so much. I love that.
Kara, thank you for sharing. Do we have, we don't have any other questions in the chat. Anybody else have anything for any of our panelists at this point? No? Okay. Well, thank you all very much for sharing with us today. We appreciate your time and your expertise. And Stacy, I'm going to turn it back over to you to move on.
Thank you. Again, really appreciate everyone's participation, hearing from all the great panelists. I'm thrilled that the Pan Ohio Hope Ride is supporting that Hope Lodge, and we're looking forward to pushing that capital campaign over the finish line this year and beyond with the proceeds that we raised from this year's Pan Ohio Hope Ride. But it's also exciting to me to just support an organization that is doing so many other amazing things in this realm of health equity, because it's just so important. So thank you so much for sharing. Again, if anyone has any follow-up questions for any of our panelists, we'd be happy to get you all their contact information. I know some of the emails have been posted in the chat already, but they're always willing to share more about what they're doing. And I just want to give a big round of applause to the American Cancer Society overall, and especially to our panelists today for sharing everything tonight. So thank you, ladies. Really appreciate you sharing your time tonight. I'm just happy and proud to be supporting this organization alongside you. Thank you. With that, I'm going to plow through a couple of event announcements really quickly because we want to get to the fun and games here. So Sean's queued up and ready to do some awesome trivia here, but I do want to announce a couple of things. First and foremost, all of you that are already registered participants did some voting this month on which jersey design you wanted to see. So we're going to be announcing this in our emails and social medias this week, but for being here tonight, you get the sneak preview. So drum roll, please, want to announce the winning jersey design, the retro look. So that red, white, blue retro look was our top vote getter for jersey voting. Yes. Thank you to all of you who voted. Super excited to see that. I think that's going to look great and some photography of all of us at that start line. So thanks for voting. Super big shout out to Randy Hammonds for all his awesome design. Can't wait to see y'all wearing that. If you are new, those of you that have been on these calls before probably know this, but if you're new, I just want to reiterate our route this year is going to start from John Carroll University to the College of Worcester to Otterbein University to our brand new partner this year that we're super excited about at the University of Dayton. And I just wanted to let you all know, if you're a registered rider, to watch your email. That lodging and transportation survey is going to be coming out soon, so you can let us know what transportation and lodging you need during our event. If you're not already registered, just wanted to share this registration structure with you. If you know people too, I think a lot of people may have missed this, that we have brought down the registration fee for 1- and 2-day riders. So if you know people that maybe don't want to do the whole 4 days, but might be interested in getting involved with us at a slightly lower level, that registration fee and fundraising minimum for 1- and 2-day riders is really accessible. And of course, we are keeping the Create Your Own 328 riders for our riders that are out of state, maybe have conflicts. They can still be a total part of our Pan Ohio family and do their miles on their own time. So, one of the things that was actually really great that came out of doing a virtual event was people being able to create their own 328 and participate whenever and however they can. If you are new to Pan Ohio, we do have a discount code for you. So if you email panohioinfo@cancer.org, we'd love to send you a 50% off discount code. And with that, this actually seems like a pretty good time to do that raffle drawing. Kristin, I'm going to stop sharing for a minute and let you have the new names, right, of some new people that are with us tonight. You want to go ahead and do the drawing for a free registration?
Absolutely. Thank you for the new riders joining us. We're super excited to give one of you free registration for the 2022 event. Brad Kerr, you have one free registration. So we will, if you can give us your email address, we will connect with you and get you set up. We're so thrilled you're going to be
Congratulations, Brad.
joining us this year.
Awesome, congrats, and welcome to the Pan Ohio family. Okay, quick reminder to everyone, we had our spring fundraising challenges going on. You've got a few more hours, so this goes through midnight tonight. If you have raised $500 between January 2nd and midnight tonight, you're going to get 15 incentive program points. What are program incentive points, you might ask? Well, we're going to be opening our store. Those of you that were with us last year may remember that we had a store where you could get points and then trade them in for whatever items you wanted, instead of us just picking one item for everyone. So our store, we're going to have 2 redemption periods, and the first of them is going to be launching this Friday, April 1st. So just for being here tonight, you get 2 incentive points, and we're going to have a raffle at the end to give away some more incentive points. But watch for that link in your email if you are a registered rider or supporter, to be able to start redeeming your points. And then we will have another redemption period at the end of the event season in late July. And also wanted to make sure that everyone saw our expanded Dynamo Club options this year. We've had this awesome Dynamo Club of our top fundraisers at 5,000 plus, and they got some awesome extra incentives for that. But we've had a lot of people even go above and beyond that. So we've officially created 2 new categories this year, the Dynamo Trailblazer at 7,500 and the Dynamo Beacon at 10,000. Really excited to say we had our first beacon. Ben Blancara hit that threshold just yesterday. So congratulations, Ben. Looking forward to seeing some more people hit that beacon, Trailblazer, and Dynamo level this year. And you can kind of see the amenities there. If you're a registered rider, you would have gotten this in your email. This information is all also on our website at pohr.org. And now let's get to the fun. If anyone has any questions, if you're new, we will stick around after for any questions anyone may have, but I think we just want to get to the fun part. So I'm going to turn this over to Sean McLean. He will explain the website and the code to get in. We're going to play some fun trivia. We've got some prizes, of course. We've got some incentive points to give away. So first place tonight's going to get 10 points. Second place will get 5 points, and third place will get 3 points. And then after that, we'll do a couple more raffles for some swag and celebrate with some photos from our 328-day events this past weekend. And then we'll just have some open time for socializing after that. So hope you all stick with us. But in the meantime, I'm going to turn this over to Trivia Master Game Show host Sean and let him take it away with our game.
Thank
By
you so
the
much.
way, I did
Thank you so
not
much.
participate in the test run with staff, so I'm totally playing.
I just put in the chat, no staff are playing. I promise we're not cheating. We're not cheating.
And then also